Over the last few years, there has been an increasing need for critical care intensivists, including advanced practice providers. The majority of current curriculum amongst APP education discussed but does not focus on training and evaluation on critical care procedures. Many institutes have recognized the critical need for adequate simulation and procedural training for their new graduate APPs and new hires. However, there has been limited data on the publication of procedural skills related to APPs. The Respiratory Institute, Department of Critical Care Medicine developed 2 training programs to ensure standardized practice across all providers and all sites. 2 courses are the Critical Care Procedure course and the Advanced Practice Provider Airway course, also known as the APPAC. Here we will discuss and describe our programs and their outcomes. The Critical Care Procedure course has been designated for APPs and residents in the acute care setting. This course consists of pre-course exhibitions and pre-testing. This is followed by a fast-paced 5-hour hands-on training. Within this class, there are skill stations to allow hands-on learning and repetition for success. Skill stations review the basics of ultrasound, the follow technique with the blue phantom, sterile technique with gown and glove, arterial line, central line placement, paracentesis, and thoracentesis. These sessions are available monthly and have between 8 to 12 learners, with a learner-to-instructor ratio of 3 to 1. Success is evaluated through checkoff and X-ray testing reviewing appropriate placement with associated adverse events. The biggest challenge that has been assessed is the limited amount of time allotted for this course. But the most consistent feedback that we have received is the desire to have more time for practice and repetition. In response to this feedback, this year we have increased a lot of time for this course by 30 minutes, with noted increase in repetition for learners. The Respiratory Institute Critical Care APP team uses REDCap to document and track the procedural data. We have reviewed the last 2 years of data from 2020 to 2022, and I've concluded that our complications have been very minimal and be contributed to our education and training curriculum. Documented complications were reviewed and found to be related to minor adverse events such as inability to pass guide wire, bleeding, or hematoma. Of these complications that had a higher percentage of adverse events came from procedures that are performed less frequently related to small sample size. The APPAC course has been designated for APPs in the critical care setting and is currently being utilized by the Respiratory Institute Emergency Medicine Department and Internal Medicine Residency Program at main campus. Prior to an in-person attendance and online pre-course work that includes an introductory lecture, detailed videos showing different airway techniques and associated pre-tests. This is then followed by an 8-hour face-to-face training allowing for application of knowledge from lectures to hands-on instruction and skill stations. Here we emphasize the adequate assessment of the patient's airway by utilizing scores of Lemon and Makocha. After completion of skill stations, the students will complete 12 simulation scenarios with task trainers. After these simulation with task trainers have been completed, the student is individually checked off on their knowledge and skills of airway assessment and intubation technique. The APPAC is held quarterly with 8 to 12 learners, and our learner-to-instructor ratio is 3 to 1. The biggest challenges encountered from this course is the high demand for the class and limited number of classes only meeting quarterly. Through the review of our REDCap data, the majority of complications noted when it comes to intubations were related to small mouth opening, anterior airways that warranted second operator attempt, or initiation of second-line intubation techniques. Our future goals for procedures within our critical care team are to attempt to achieve 100% independent credentialing for all of our APPs. We will be able to increase these procedures and training with the addition of our APP-specific procedure team at our main campus MICUs. We wanted to also take the time to thank you for those who have helped create content and train our students, and forever grateful for your dedication. Thank you.